A bit ambitious to claim that we will try to end polygonosis from Ethiopia as well as other countries. But as you have mentioned earlier, podo is somehow influenced by genetic factors, but genetics is not the sole determinant of polygonosis. If naturally susceptible individuals wear protective shoes and keep their food hygiene, they won't develop polygonosis. Let me try to make this very clear. Even you and I may have the natural susceptibility, we don't know that. But you and I are not developing podo or have not developed podo yet because we have been wearing shoes on a constant basis. So genetics is not the sole determinant. That's why we are determined and we are hopeful that we can see the end of podo in our lifetime. And polygonosis has been eliminated in countries where shoe wearing is a norm. So by just controlling the environmental factor, we can eliminate polygonosis. But it's not easy to convince people to wear shoes on a constant basis because there are various reasons behind that. Some of them are cultural, some of them are economic factors related to poverty. So it's not easy, but if we can work on the environmental factor, we can end polygonosis. And did you ask another question? Did you raise another issue about podo?
Maybe it increases by age.
Yeah, that's because it develops when individuals have prolonged contact with red clay soil, which is very common in southern Ethiopia as well as in northern part of Ethiopia, in Amara region, for instance. So people are likely to develop podo because when they have this prolonged contact with the red clay soil. That is probably one of the reasons, I believe. I hope I have responded to your question.
I think it can be eliminated, it can be controlled and eliminated in the end. That's one thing. But our project's aim or goal is modest in a way that we are not saying that we will end podo within the next 3 years. But what we are saying is that we will end neglect. So bring more attention, policy attention, research attention, intervention attention to podo and scabies. So we try to end that neglect or bringing to policy attention. I think that needs to be qualified. Although there is also ambition and strategic plan to end podo. Another issue perhaps I would like to highlight is that also that podo is prevalent or rampant in areas where in island areas where there was volcanic history, where there is this red silica soil, which Kubur mentioned. So it doesn't mean that I might have genetic susceptibility, as Dr. Kubur said. You might have genetic susceptibility, but if there is no that silica particle, clay soil in areas, in island areas that you find like around Wolaita, around Marcos, around Gondar, so it's in pockets of areas, more predominant in southern part, in Oromia, in Amara region, but not in all parts of the country, not maybe not. So there are a lot of areas where people walk barefoot, farmers walk barefoot, children walk barefoot, but they don't get it. So we should also consider it from this perspective. It's not, it's not all over the country, or it's not everyone. So genetic susceptibility, as Kubur said, still people with genetic susceptibility can prevent it if they put on the shoes consistently and early on. That's what we are saying. In areas where there is this silica particle or this soil that really, it's the interaction of the two. So it's the interaction of the two, genetics and environment. So if only genetics cannot really put people at risk. It's genetics plus environment or exposure to soil. Prolonged exposure. That's why all people get it. It's prolonged exposure to soil.
እነዚህን ኢሹዎች የተከተለ አፕሮች ጎጥ ምንድነው እንዳሁን ነው አሁን ያለው ነው የሚባልና ቦተም አፕ አፕሮች እንዲሆን ማለት ነገር አስፈላጊ ይመስለኛል። ኮሚኒቲ ሌቭል ዲስከሽኖች መሆን ይቻላል። እነዚህ ኢሹዎች ዝም ብለን ፖሊሲ ኮሚኒቲ አስተሳሰቦች ኖርሙ ቫልዩ ምን ይላል? አሁን ቅድም የቀረቡት ቲያትር እኮ ስለዚህ ስለ ከብት ስለ ድሃን ስለዚህ እነዚህ ኢሹዎች በቀላሉ አድሬስ የሚደረጉ እንደ ድራማ ወዲያው የሚያልቅ አይነት ነገር አለ። ቦተም አፕ አፕሮች ኢንክሉሲቭ እያንዳንዱ ለምሳሌ ሶሺዮ ኢኮኖሚክ ዲፍረንሱ ያገናዘበ በዛ ወይ ፖሊሲ ዲዛይን መደረግ አለበት ነገር ምን እያንዳንዱ የሚያገባቸው ሴቶችን ኢንክሉሲቭ አፕሮቾችን መከተል ያለብን ይመስለኛል። የእናንተም ሀሳብ
የሚሰጠው ከዛ በኋላ ራሳችን ጀምሮ ነገር ሊሆን ይችላል። አብሮ ሲስተም እንዴት አድርገን የምንሰራ ነው። አሁን የሚጠና ሪሰርች ፉሊ ወደ ገቨርንመንት ሲስተም ውስጥ ማስገባት የምንችል አንድ የሆነ ስትራቴጂ አብሮ እዛ ጋር ከተገባለት መስመር ስቲል አሁን በዛ ፊል አለ እንትኑ ጥሩ ብሎ እያለ ግን መጠቀም ካልቻልንበት
እንትኖቹ የተያያዙ ናቸው። የመጀመሪያው ዋላማ ሁላችንም ጠባቂ እና ያ የምጠቅመው ግን እንዴት ያው ተከታታይ ነው። ሰዓት ነው የሚያደርሰበት የተወሰነ ሀሳብ ከያዘን በጥሩነት እና አንዳንድ ነገሮችን እናገኛለን። ሰርች ሪዛልቱ እንዴት አፕላይ ይደረጋል ተከታታይ አስተያየት ስም
ሀሳብ ለመጨመር መስራቱ ላይ ኮሚኒኬሽን ሲስተም አለ። ያው ግን ዋናው ነገር የሰራው አካል ሪስፖንስብል መሆኑ ነው። ምክንያቱም የሰራው ነገር ኮኔክት ሲያደርግ ታሰበ አሁን ያደረገው ነገር ሪስፖንሲቢሊቲ ወሳኝ
ሰዎች ልዩ የሚያጋጥማቸው ችግር ምንድን ነው? አንደኛ ማህበረሰብ ውስጥ መቀላቀል ነው ወይ ሶሻል እነሱ ጋር መቀላቀል ችግር አለባቸው። አንድ ሁለተኛው ደግሞ ፕሮዳክቲቪቲ ምን ያክል ተጽዕኖ አድርሶባቸዋል። ገበሬ ከነበረ እርሻውን እንዳያዝ በምን ያክል ዲግሪ አፌክት አድርጓል። ሌሎች እንደዚህ ፋክተሮች ነጋዴ ከሆነ ተማሪ ከሆነበት ስለዚህ እያንዳንዱ እንግዲህ እያንዳንዱ ዶክመንት ላይ ለምሳሌ ዋሽ እንግዲህ ዋሽ ስንል ኢንፍራስትራክቸር ብቻ የሶፍትዌር ብሔራዊ ሴንስ ብቻ አግረሲቭ መሰራት አለበት። ያም ይጨምራል። እነዚህ ኮምፖነንቶች በደንብ ይጨምራል። ስለዚህ ምን አይነት ሜሴጆች ናቸው እዛ ውስጥ አንድ ትራንስሌሽን ካውንስል ስታደርግ ምን አይነት ሜሴጆች ማስተላለፍ አለበት? አንድ ተማሪዎችን ካውንስል ሲያደርግ ወይ ደግሞ ወላጆችን ካውንስል ትሪት ሲያደርግ ትሪት ካደረገው በኋላ ሪሃብሊቴት ማድረግ አለበት። ሪሃብሊቴት ሲያደርግ ምን አይነት ሜሴጆችን ነው ማስተላለፍ ያለበት የሚለው ሁሉ እነዚህ ሜሴጆች በየወዳቱ ና ተቀምጠው ከዚያ ወደ ስትራቴጂ ዳይሬክትሊ አድርገዋል። ይህን ካደረገ በኋላ ያው
different courses like medical sociology, medical anthropology, rural sociology and development. So we can touch it in one or another way. Then any interested individuals, staff members, and students can conduct research or studies in this area. Therefore, it is very important. It's also can be input for health policies and rural and urban development policies and environmental policy. But an idea raised from, especially from health qualitative, the research which we conduct on this photo and studies should be intervention one, which is should be actual research. So it should come with comprehensive data, since it might be used as an input for policy formulation in the basis and the like. And this is our response for the first question. And then, regarding with the question number 2, yes, about the problems or challenges existing with policies and guidelines. The existing policies and guidelines about PODO and SCABIS at the interim level, it's not as such well organized, articulated, and we heard the information from the health representative that the guideline was prepared by foreigners, and it is not as such detailed and have comprehensive information just to put into practice the guideline. So it lacks many application parties, especially in preventive and curative area. So it needs a kind of well-articulated guidelines and the policies. So this is existing, and the solution should be well-articulated and in an applicable way in our context. Is what we have discussed. Regarding with the third one, about the approaches in order to improve the existing NETD policies, guidelines, and strategies. The existing policies, guidelines, and strategies lack social aspects, and social scientists are not as such engaged in the designing and implementation of the policies and guidelines and strategies. Thus, social scientists and community leaders, religious leaders, open leaders, and the like should be invited in the policy designing and implementation, just to have comprehensive and inclusive policies and guidelines and strategies, just to improve the existing challenges and problems. And it's, the policies and strategies and guidelines related with PODOs and SCABIS and the like should follow bottom-up approach. Should engage different concerned bodies, the stakeholders, just to make it comprehensive and inclusive. This is the point we have agreed. The fourth one is about stakeholder, improving stakeholder engagement and policy debate by various NETD actors and social scientists and the like. We have to stakeholder engagement and policy debate by various NETD, inviting and engaging different actors like community leaders, religious leaders, and open leaders, and different trainings and workshops, and like that of policy designing and evaluation and the like, monitoring, just to hear from their side is the way that can improve this stakeholder engagement. The fifth one is about channels of to increase the number of actors. We can use different mass medias, community radios and the like. We have to identify appropriate person, those who can contribute very much just to improve these issues in one or another ways. We have to establish a kind of information desk at Kabale level or different government structures and the like. And we can also use elder station workers and development armies that exist in different levels of structures. In the case of refugee, for example, we can use psychosocial supporters or workers and others. There are so many people who are engaged or working different refugees in different areas, like improving livelihoods and providing counseling services and different health-related issues and the like. We can also generally use existing structures in general, just to as a channel to increase the number and type of actors involved in conversation about NEDs and neglected therapeutic disease and their social dimension. The final one is every one of us, all of us, agree that we can plan and execute in our each and every activities when we think about these photos and activities. For example, in the case of ours, an academic area, we can plan and execute research and community services in these areas, and we can engage students to conduct their research in this area. We can also disseminate information through different ways, like social networks and the like. And individually, we can also create awareness and the like through using the existing enabling structures and the like. This is all what we have discussed in our group. Thank you very much.
Thank you so much. Any
Policies, more importantly, the entity master plan, because among the 9 entities which are prioritized by the Ministry of Health are the protocols and scales, and this project also focusing on these priority entities. Mainly, we have shared our experience, the Nepal's experience. It totally helps us a lot for further programming, mainly programs, interventions which focus on the behavioral change communication aspects. So the group totally agreed on the alignment of the foundation with the policies and activities. The second one is the problems and challenges with the existing policy and guidelines. We have raised two challenges. The existing policy and guidelines are not accessible mainly at the grassroots level, at the periphery. For example, when you see the lymphedema morbidity management, they are not you can't find them in the primary health care unit, in the health centers, at the Warada, at the zonal health department. So they should be accessible at all levels, mainly at the grassroots level, where they are supposed to serve. The other is the policies and the guidelines do not boldly articulate the social science perspective. And we have raised also that there is a poor advocacy of social science perspective while developing and preparing all these policies and guidelines. So this should be, in the future, take due consideration. The third question, what approach should be followed in order to improve the entity policy guidelines? Yes, for all of them, for all of the listed documents, we have agreed that there should be active engagement in the entity task force and technical working groups that are established platforms that the Ministry of Health is leading and organizing. So the social science researchers or scientists should actively engage on this so that they can use the platform to influence, or so that this social science perspective will be incorporated in every guideline and master plan development. Organizing social science conferences and symposiums or entities. This is also important, different researchers to link with the stakeholders and with policymakers. And these social science researchers should also be, should voice on the need of the social science role on the success of public health programs. The fourth one, what can be done to improve stakeholder engagement and policy debate in various entity actors? Yes, we have raised two important things. One is organizing regular stakeholder meeting and workshop. The other is establishing strong networking that link entity actors and social scientists. And such similar approach and initiatives should be in place so that the stakeholder will be on board regarding this NTD. What channels do you think best suit our BACC officer from Ministry of Health told us that it's very important and critical to identify and segment stakeholders in every BCC interventions we do. It's highly important, or by far the most important component. First, we have to identify our stakeholders, and we have to be able to segment them based on different criteria or grouping parameters. Maybe the last but not the least, what and how do you like to contribute to the success of the project? The Ministry of Health said that
it will create every necessary and required enabling environment for the project to be successful by informing or sharing information, providing available existing documents and resources. And when it comes to NAPAN, NAPAN is keen to support this project, mainly through patient and community mobilization and any other support that the foundation requires at the periphery. The ARA also said that whenever they are going to implement this project in refugees, the necessary support, government support will be available and ready so that this foundation will be successful. Thank you. Making publications. All the publications are on the shelf. They are not, with us. The program person is leading the Amhara region NTD program. Not only these researches that will happen in the future, but other researches are not. There is a gap in bridging the researches with the program people. So there should be a way by which the research findings could influence the program, so that the program people will harness and utilize the research findings. So this was the point that I missed.